Hi, Herman Pang here. I'm the Medical Director for Antebellum Medical. Let's talk a little bit about a fairly new way of treating disease. That's using one's own stem cells. Now, a stem cell is an interesting factor, shall we say. Stem cells are in every one of us. There are actually billions and billions of stem cells. And what a stem cell is, it's an undifferentiated cell, meaning that it hasn't specialized into skin, bone, heart, lung. It's sort of the beginning type of a cell, and it has the ability to then differentiate or to specialize into one of the other parts of our body, be it a tendon, ligament, even brain and heart. So a stem cell, which we all have a lot of regenerative features that have only more recently been discovered and researched. And so when I talk about stem cells, I am talking about cells that are coming from your own body. You can get stem cells from bone marrow. It's a little bit painful to do that. You can also get stem cells from your fat, which is relatively painless. So in the process of harvesting stem cells, we take about 3 ounces of your fat, and what I'd like to do is think about stem cells in this manner. Think of a fat cell as a watermelon. Think of a stem cell as a raisin. And you have all these raisins around these watermelons. And you take out 3 ounces of the watermelons, which have the attached raisins or stem cells. And then once we do that, there's a process where one can incubate and then separate the raisins from the watermelon. And then we get rid of the watermelons, but we keep the stem cells or the raisins, and then they can be deployed in various manners to help with the regenerative function of the body. So let's talk about what we can use stem cells for. There's a lot of regenerative capabilities in your own stem cells. It's your body's ability to heal itself. So you can use stem cells to treat neurologic conditions such as Parkinson's, multiple sclerosis. It can be used for heart and lung disorders such as COPD and heart attack, strokes, and other sort of rather debilitating disease conditions. The most common use for stem cells is probably the treatment of musculoskeletal disorders. I think worldwide it's the most common reason that stem cells are used. And the most common musculoskeletal disorder that we use stem cells for is for the knee. By and far, that's probably the very largest number of studies and patients for knee problems. In fact, I can tell you from my own personal experience, I was having trouble with my own knees, and about 10 years ago, my stem cells were harvested and injected into my knees, and I was able to avoid an operation to get a knee replacement. Here is a very good example. This patient had issues with his shoulder, and what we're going to do and what you'll see following is the actual procedure that's done for this young male who's had a lot of shoulder problems, and he doesn't want to get an operation on his shoulder. this is the patient's PRP, or his blood. We're going to actually spin it and get the PRP. It takes about 9 minutes to spin. One, two, three, poke. A little more medicine. Hurts, then we can give you medicine, but I think you'll be fine. Here we go. You're doing all right? Good. You got good fat, so that means you'll get good stem cells.
Okay.
So we got 40, 50, 60, good. And decant this. All through there?
Yeah. Okay. So I'm just gonna tell him it's.
Hurt?
A little bit, but not
really?
Not really. That hurts.
Yeah. I'll go slow. Doing all right?
Mm-hmm.
Good man. Probably see there's a lot of information on stem cells and a lot of benefits. To get more information and to understand better, please call the office and we'll be happy to schedule a consultation for you.